The coronavirus.
Coronavirus.
Deadly coronavirus.
Where the coronavirus.
Coronavirus. Coronavirus.
Coronavirus.
Coronavirus.
Strain of coronavirus.
Coronavirus. The coronavirus.
The virus upon BAME communities in the UK, and we've also seen that in some other countries around the world as well. And it's for that reason that the Chief Medical Officer commissioned work from Public Health England to better understand this issue. There are a number of reasons for that have been posited, and it's right that we do thorough research swiftly so that we can better understand it and then take any action that is required.
In late 2019, Covid-19 was spreading across China. Little did we know that it would arrive on our shores in early 2020. The world is not as big as we think. What happens far away can affect us here too. In recent weeks, we have heard reports of people from the Black, Asian, minority ethnic community being disproportionately affected by Covid-19 compared to other ethnicities. According to the Office for National Statistics, black men in England and Wales are 4.2 times more likely to die with Covid-19. Black women 4.3 times more likely to die after contracting the virus. People of Bangladeshi, Pakistani and Indian origin, as well as mixed ethnicities, also have a significant risk of dying from coronavirus. We know that a lot of the members of this community are frontline health workers and key workers. There may be a number of factors contributing to these tragic statistics, and more is being done to understand the impact of the virus on different groups. Although we do not know the full reasons why the BAME community are disproportionately affected, one thing we do know is the importance of maintaining good health and seeking the right medical support, particularly in the BAME community where conditions such as hypertension, diabetes, heart disease and kidney disease are more prevalent. There are many things you can do to maintain good health, and when you need us, we are here to help you now and beyond this pandemic. Here is a short film where we explain how you can keep healthy.
So how do we reduce our risk of developing chronic diseases? Eating a healthy, balanced diet, so maintaining a normal body weight and normal cholesterol, regular physical activity, drinking alcohol within recommended limits, so up to 14 units or 6 pints of beer per week. If we're smokers, then stopping smoking. Knowing our family history, the Black and South Asian population are at higher risk of developing diabetes, cardiovascular disease, so being aware of this and managing these diseases before we develop complications.
We are 2 to 4 times more likely to develop type 2 diabetes if you're African, Caribbean or of South Asian descent, and this risk increases once you're over 25 years of age. It's important we continue to eat a healthy, balanced diet containing whole grains, healthy portions of protein, 5 portions of fruits and vegetables per day, have 6 to 8 glasses of water, healthy oils, and stay active. If you're concerned you may have type 2 diabetes, please see your GP. Also, if you've been diagnosed with diabetes, take your regular medications prescribed and attend your annual health checks.
Renal failure is up to 5 times more common in the BAME community. We do not fully understand as to why, but high rates of diabetes and high blood pressure in our community could be the cause. For example, Asian people with diabetes are up to 10 times more likely to develop kidney failure as compared to white people with diabetes. We urge people to go and have blood tests to check their kidney function and also to manage their diabetes and blood pressure well.
Don't ignore any eye symptoms such as pain, redness, blurred vision, or any other changes to your vision. This is because this may be the only warning sign for a very common eye condition called glaucoma. Glaucoma is caused by a buildup of pressure inside your eye, causing damage to the main nerve of the eye called the optic nerve and therefore blindness. Talk to your GP, speak to your optician as soon as you notice any of these changes or symptoms. If you're 40 years or older, you must have a regular eye test because early detection and treatment can save your vision.
The African and Asian communities tend to suffer from high blood pressure. The cause is unknown.
but genetic factors play a role. It's important to have your blood pressure monitored, eat less salt, be compliant with your medication, eat food low in cholesterol, do physical activity. All that can reduce your chances of having heart attack or stroke.
There is a high prevalence of heart disease in the BAME community. High cholesterol level and high salt intake are risk factors that can lead to heart disease, strokes, and even kidney stones. High cholesterol may have a genetic link but could also be due to increasing age, lifestyle, stress, and disease such as diabetes. High salt intake can lead to high blood pressure. Eating foods low in cholesterol, reducing your salt intake and alcohol consumption, regular exercises, and quitting smoking could all help. And if you're over 40 years old, please attend your annual NHS health check for a fasting blood test to check your cholesterol level and also blood pressure.
Vitamin D is crucial for the health of our bones and muscles. However, those of us with darker skin aren't able to absorb as much from sunlight. That's why the NHS recommends that if you're from a black or ethnic minority background, you should take 10 micrograms of vitamin D every day throughout the year. Some of us may be deficient in vitamin D, and in that case, you should try and see your GP to discuss if you need a higher dose. But this is a really easy step to take, so take control of your health and take vitamin D.
Prostate cancer, for most men, is a mild disease in old age, but not for black men. 1 in 4 black men like myself will develop prostate cancer in our lifetime, compared to 1 in 8 men worldwide. More of us are also dying from a faster growing disease and later diagnosis. Early screening, which involves a blood test called PSA and an examination, is critical. All black men over the age of 45 should discuss screening with their GPs as soon as possible. We need more black men living longer.
Uptake of vaccines amongst the black and ethnic minority population is lower than expected. Vaccinating your child can help protect them from preventable, life-threatening infections. The good news is, vaccines are free. It starts off at 2 months of age and runs throughout childhood. If you are considered high risk of TB, have HIV or hepatitis, you can vaccinate and protect your child from birth. If you have any questions, please talk to your GP, health visitor, or go online. But remember, prevention is better than cure.
Despite the COVID pandemic, people still have urgent medical problems which have to be treated without delay. If you feel unwell, call your GP or 111. It may take a little bit longer than usual, but we are still here, ready to help. If it is life-threatening, call 999 or go to the hospital. Hospitals have made changes so that suspected COVID patients are being managed separately.
The Black, Asian and ethnic minority population often work hard and work long hours, but you need to make time to take care of yourself. If you have existing health conditions, please follow up with your GP. But if you don't and you are between the ages of 40 and 75, then you can have a free NHS health check with your GP. You can also go online to assess your risk for conditions like diabetes, heart attacks, strokes, etc. on the NHS website. Just go to www.nhs.uk to find out how to do this.
Socio-economic factors such as health issues, living conditions, and occupation could play a role in explaining why those of us from a BME background are dying from COVID-19. We are more likely to be living in overcrowded accommodation and less likely to have access to good healthcare. We are also more likely to be working in low-paid, high-risk frontline jobs that mean we come into contact with more people every day. That puts us at a higher risk of catching the virus and bringing it home.
About 1 in 4 people in the UK have mental health issues, and that includes members of our BAME community. Remember, reach out if you're struggling. Doctors are here to help. Intentionally seek out to stay connected with loved ones. exercise and stay active. Minimize the amount of news you consume and only get information from reputable sources. Rest to improve your mood and the ability to function. Online resources and apps are available. Develop a routine that prioritizes taking care of yourself. We're going to get through this together.
When it comes to babies, we tend to think the chubbier, the cuter. But unfortunately, early childhood obesity is becoming an increasing problem worldwide. Even more worrying is if you're overweight as a child, you're much more likely to be overweight or obese into adulthood. So what can we do? Firstly, be a role model for our children. Keep active with them, at least 60 minutes of activity a day. Remember to serve them child-sized portions with lots of fruits and vegetables. And finally, avoid sugary foods and reduce the number of snacks that they're having.
Many people have been going to work every single day during this COVID crisis. These people have been working harder than ever before to provide essential services for the people of the UK. This includes NHS staff, carers, social workers, school teachers, delivery drivers, supermarket workers, emergency services, postal workers, public transport, taxis, and so many more. Thank you so much for everything that you are doing. Finally, let's take a moment to pay tribute to all those who have lost their lives. To those NHS staff and key workers who paid the ultimate sacrifice. We offer our sincerest condolences to your friends, families and loved ones. Know that your memory will live on always in their hearts, and we will always remember you as heroes. Thank you.
The disproportionate rates of deaths due to COVID-19 in the BAME community has highlighted inequalities in healthcare which need to be addressed. We need better healthcare for everyone, but especially for people from the BAME community who have been hardest hit by the COVID-19 pandemic. Although we're still under lockdown, we need to look beyond this COVID-19 pandemic and make plans to work together to achieve equity in healthcare for all communities, especially for those within the BAME community. Lessons learned from hindsight. We're only as strong as our weakest link. What affects our community affects the rest of the UK.